Today on the show, we're back at the office of Dr. Sonia Spencer here on Pass Road in Gulfport, and we wanted to cover some things today that we've actually never really touched upon, and that's common myths about chiropractors. I mean, you hear people talk about, well, this and that, and do they really do this, or can they do this, or whatever. So we wanted to cover some of those with you today, if we could. And the first one I'm going to say, does getting, because a lot of people think, oh, they come in and like pop you on the back and they jerk your head around, and does getting adjusted hurt?
That's a great question, Jim, and I'm going to say not for most people. Okay, for most of the patients that come in, it's an awesome, pleasant experience that they want more of. Mm-hmm. You know, and we do our best to make every treatment that we do in this office very gentle and very pleasant. And just like any other type of treatment that you get, if you go in and get a massage, sometimes it might get a little uncomfortable, but you just have to give feedback to your practitioner. You know, like, that wasn't very pleasant for me to have that much pressure, or that was a little bit too rough for me. Sometimes we have patients that come in that have fibromyalgia that we have to be very, very gentle.
Yes.
I mean, just touching them like this hurts, but you know, you can hardly feel that, but some people are so pain sensitive that we have to be very, very gentle with those patients. And so, you know, I've been in practice almost 20 years, and so I know how to listen to somebody talk about their pain threshold. And so I do my best to make sure that most of what we do, I'm not going to say everything's pain-free, but most of what we do is as gentle as possible and as pleasant as possible, so that we have a happy, satisfied patient that's getting better with as minimal amount of pain as possible.
Your hands are your tools. Mm-hmm. That's what you work with. And you can, I mean, you get to the point where you can feel when, you know, you're on somebody's lower back or whatever, you know.
Yes.
You know, it's almost like your hands can read their minds.
My hands are mind readers, and you can feel inflammation. You can feel when somebody is pulling away from you and so forth. So yes, your hands become your instruments, and they are your little mind readers.
There you go. Okay.
Yes.
How about this one? Once you start, you can't stop.
Well, you can stop chiropractic care anytime you want to. What we give you when you come in is a plan of care and a plan of action. When you want to stop care, we're not going to come get you and force you to come here. So we do have a lot of patients that come in for wellness care because they want to maintain their health. Just like once you start brushing your teeth, are you ever going to stop brushing your teeth?
No.
No. You're not ever going to stop brushing your teeth. You're not ever going to quit taking a bath.
Might end up putting them in a glass jar or somewhere.
Right.
With a fix-it.
Are you going to stop eating?
No.
No. So some people are going to choose to never stop taking care of their spine and nerve system. And to some people, it's not that important. So when you tell us what your thought level is on this, to some people it's very important to take care of their spine and nerve system, and for some people they could really care less. Like some people never go to the dentist because their teeth aren't really that important, and some people it's extremely important.
Sure.
So it's your choice.
Now, and to say this, you evaluate every individual patient as to what type of care plan they need, as you did with me.
Yes.
When I had, and you know, went through the whole thing, and just, you know, to this day, I feel so much relief because I came to you. And honestly, I'd never been to a chiropractor before.
Awesome.
Until I came to you.
I'm so glad you came in, Jim. And you know what? I'm so glad you're happy with your care.
Oh, I am. Very much so. Another myth, it's expensive.
Yes. Well, all health care is very expensive. You know, to take care of your body, and, you know, dental care is expensive, health care is expensive, you know, car care is expensive. Living today is expensive. All of life is expensive. So you have to prioritize. Again, that kind of goes with that other question. You have to determine what your priorities are. And overall, if you look at chiropractic care compared to co-pays and of drugs and spinal surgeries and other treatment options, you know, we're definitely hands down one of the most cost-effective, cheapest treatments that exists. If you look at comparison studies, chiropractic wins every time.
Just like you said, what is your body and your health worth to you?
Exactly.
So how about, it's dangerous?
It's dangerous. Well, chiropractic is the safest form of treatment that exist, bar none. And
Wow.
that's based on, not my opinion, but the research. And, my malpractice insurance is cheaper than a lot of people's car insurance. We have cheaper malpractice insurance than every medical doctor that exists. Now, that's because what we do is safe. And we're trained to evaluate people for problems that should not be adjusted, like broken bones and metastatic bone cancer and dislocations and things like that, and not to fool with those type of people who should not be getting adjusted, bone softening diseases and things of that nature. And those things, of course, are not safe to adjust, and so that's why we evaluate before we treat. Mm-hmm. We refer people out that should not be adjusted. That's only a small portion of the, but if someone, well, let me rephrase that. That's why we evaluate everyone.
Right.
Before we treat. We evaluate before we treat, and some people are not happy about that. They just want to come in here and get treated. If you want that, don't come here, because we're going to check you out before we do anything to you.
That's how they're going to end up getting proper results.
That's right.
I mean, they just come in here, I need my back pop, I need my neck adjusted, something
Right.
like that. Maybe you don't.
Right.
Maybe it's something else.
Exactly. And so we always evaluate before we treat at Spencer Chiropractic, and we pride ourselves on being thorough and professional.
How about pregnant women?
Pregnant women respond great to chiropractic care. I've taken many of our patients all the way through their pregnancy. They have better deliveries when they're under chiropractic care, less low back pain. Of course, they don't want to take medications when they're pregnant because they want to, make sure that their unborn child doesn't have to take those medications with them. And I help them have fantastic pregnancies, and better deliveries. And of course, they come in right after and resume, their wellness care because they value their body and their health.
That's important.
It's just part of what they do.
All right, that's awesome. I mean, as you see, there's probably some other things, but those are the most common myths regarding chiropractic work.
Yes.
So, but I can assure you, from a personal standpoint, working with Dr. Spencer in the past, that it's been great. You have that little nervousness at first when you're laying there with your face down. You say, "Okay, turn your head." But you're awesome.
Yeah,
You're
it's
absolutely
very
awesome.
gentle, it's very effective, and no drugs, no surgery. Compared to drugs and surgery, chiropractic has very little side effects, and that's what people are wanting, natural health care without drugs and surgery, and that's what we do at Spencer Chiropractic.
Definitely. So if you need some help, give them a call, set up an appointment. Dr. Sonia Spencer, Spencer Chiropractic, they're on Pass Road in Gulfport across from Pass Road Elementary.